Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. I did get a comment from a subscriber and member, one voice in the crowd. Thank you so much for your comment. I really appreciate it. You highlighted some issues at a Western New York VHA facility, and I will tell you this, even if you are not in New York, guess what? This could be happening in your backyard. So keep a watchful eye because, you know, you never know what you're going to get sometimes when you walk into different facilities. Now, I'm not saying this is happening everywhere, but I'm just saying that it could be. So it's important for you to just be aware. And I will tell you this, I'm going to preface it with, I am glad that there is action taken. And there has been a lot of action taken at the VHA and Veterans Benefits Administration as far as getting rid of some bad seeds, so for lack of a better way of putting it. So let's jump into this. Hit the thumbs up, subscribe, share with a friend, all that good stuff. I really appreciate it. Every thumbs up and every minute watched helps the channel grow and push out more information to more of our brothers and sisters. So thank you so much. If you want to support the channel in other ways, you can do that by going to the homepage. You'll see the highlighted members and a join button. You can join there. Thank you so much to all you members. All right, jumping into this. Langworthy calls out VA over care of Western New York veterans. Two top officials removed from posts. So jumping into this article this is an interesting one. It was a little hard to find, so I appreciate the comment. I'm glad that I saw it. So this is starting off here. In the wake of accusations of poor and delayed care for Western New York veterans at the Buffalo VA Medical Center, its director and chief of staff have been removed. So both the director and the chief of staff gone. Interesting. Moving on, Channel 2 News, WGRZ reported Tuesday that according to the U.S. Department of Veterans Affairs, Michael Schwartz, Healthcare Systems Director and of the VA Western New York, and I'm guessing Philippe Jaoud, I don't know how to say it, Chief of Staff, were removed from their positions amid allegations from clinicians of delayed care, misconduct, and administrative failures. Delayed care. Wonderful. Earlier Tuesday, U.S. Representative Nick Langworthy had called for immediate action and transparency from the VA following the allegations regarding the center. In a letter to the VA Secretary, Langworthy expressed specific concern over reports provided to the House Veterans Affairs Committee that veterans may have experienced significant delays in receiving critical cancer treatments. That's Stan in the background. For those that don't know, he's my rooster and he likes to chime in. So here's the deal. If you are experiencing lengthy, abnormal wait times, probably just reach out to your congressional member and let them know. And also reach out to the committee, the Veterans Affairs Committee on either the House or both, either the House or Senate side or both, right? And let them know that you feel as though there's some abnormal wait times. Moving on. Earlier this month, Channel 7 News, WKBW, reported that Western New York veterans have been frustrated with their care at the VA Medical Center. Now, I'll tell you that New York, I believe, off the top of my head, is the fourth. It's either number 4 or number 5. I think it's number 4 as far as veteran-populated states. So this is kind of a big deal. Moving on. One Vietnam War veteran who has been having painful problems with his feet said he gets an x-ray. Doctors contact him months later. Another Vietnam veteran, a retired lieutenant colonel, said there's a backlog and staffing is overwhelmed at the Buffalo VA. Langworthy stated the VA's administrative failures have left veterans battling cancer, heroes who risked everything for this country, waiting far too long for the care they need. The situation is unacceptable, and we owe it to our veterans to get to the bottom of it. I'm going to throw in here, and you wonder why people want community care. The VA, if it was a standalone business that you could choose where you want to go without an issue, right? There's some, not all, there's plenty of great VHA locations. Plenty of them. I've been to a lot of them, love them, great staff, great service, great everything. It's the leadership at that location level that really sets that tone. So it's not the higher VA, right? It's the condensed down geographic areas. But it needs to be treated like a business. You have customers, you need to treat your customers good. And, if that's what you're trying to do is treat customers good, get them the care they need in a timely manner, you're not going to have these kind of issues. Let's move on. The Western New York congressman said the VA must conduct a thorough review, cooperate fully with the House Committee's investigation, and make improvements where necessary. I will closely monitor the situation and continue to press for accountability to guarantee that no veterans' health is compromised due to administrative failures, Langworthy said. I strongly encourage VA to cooperate with the committee's request for information and any follow-up investigation the committee may pursue. A VA spokesperson released a statement on Channel 2 Tuesday saying that upon learning of the concerns raised about the local leadership and instances of delayed care, the VA transferred the 2 executives out of clinical and veteran-facing positions pending the results of an investigation. Swartz had been serving as interim director and then director for the VA Western New York since January 2018. Prior to assuming that position, he served as director of the CANDAIGUA VA Medical Center since August 2016, and he served as director of the Bath VA Medical Center since 2012. The VA stated on Channel 2 that providing veterans with the world-class care they deserve when and where they need it is a top priority, and VA has taken immediate steps to ensure the healthcare needs of veterans are being met. Citing the ongoing investigation, the federal agency said it could not comment further. A spokesperson with the VA had stated that to Channel 7 after its report that it takes too long to get a veteran access to needed care at the VA facility, or if a veteran must travel too far for care, the VA ensures that that care is received through a community provider. Again, talking about community care. Veterans eligible for community care can choose to receive care from a provider in VA's community care network. In fact, VA has delivered all-time record numbers of community care appointments to veterans during each of the past 6 years, including 46 million appointments in 2023, and we are on pace to break that record again this year, the VA stated. The VA noted its Western New York healthcare system has healthcare locations in 8 counties. It serves there in New York, and with the community-based outpatient clinics in other locations throughout the area. Langworthy introduces additional legislation as well, and wanted to just throw out there to you. So look, the bottom line of all of this is keep a clear eye on abnormally long time frames for your care. Push for community care when available to you, and if you feel as though you are being, I guess, shortchanged in this, your desire to receive medical care, reach out to your congressional members, reach out to the Committee on Veterans Affairs for either the House or the Senate side, inform the Inspector General, right? These are the things that create a situation where a closer look could be warranted and can actually affect change. So with that, thank you so much for watching. I appreciate you. Have a great one, and remember, if we don't take care of each other, something went wrong.